Yeah, welcome to all. I am Dr. Chakradhar, consultant neurologist at Renova Hospital. Now we will discuss about the stroke, and because everyone need to have an idea about stroke in these days, because stroke is the second most leading cause of death after cardiac problems, and in India, about 2 persons in every 100 members will suffer every year with this problem. And recently, even the younger generations are getting affected with this problem. And most important thing is the management of stroke is time bound. That means only the treatment can be given in a specific time period only. So it becomes utmost important to have some knowledge about the basic aspects of the stroke. Coming to the topic proper, that is, what is stroke? In simple language, we can say that it is mainly due to the impairment of the blood supply to the brain because of the rupture of the blood vessels and causing hemorrhage within the brain. How do we identify a stroke? Is For this we have developed a mnemonic, that is BFAST. That means BEFAST. B means problem with the balance, or E, any problem with the eyesight or vision. F stands for facial weakness. A stands for any arm weakness or appendicular weakness. S stands for speech, sudden onset of any speech problem. And T for time, that is time for emergency call. That means whenever someone detects, remember these mnemonic, and someone identifies a person with having sudden, who is developing these kind of symptoms, should strike that person might be suffering from stroke, and he should be rushed to an emergency. Coming then, what are the major causes of stroke? One of the leading causes, along with the age, most of the older population gets affected naturally with the stroke. And other modifiable risk factors are hypertension, diabetes, smoking, alcohol, and certain rare causes such as genetic causes and inherited causes, maybe other causes of stroke. Now, how to manage the stroke condition? Let us see. Initially, one has to know about there are two kinds of strokes. That is, one is ischemic stroke and hemorrhagic stroke. The management will be differing. Most of the time, we need to know about the ischemic stroke management, as there are recent advances in this management, and they have very good response outcomes when given at a proper time duration. That is, in case of an ischemic stroke or any person suspected to be having a stroke, when brought to emergency, he should undergo either a CT scan or an MRI to confirm the diagnosis of a stroke. And once the ischemic stroke has been diagnosed, he there are certain guidelines. Depending upon the guidelines, certain injections such as thrombolytic agents we call, which can be given up to 4.5 hours from the onset of the stroke. And further in advancement, or further depending upon the type of lesion, there is another thrombectomy. Mechanical thrombectomy is another sophisticated procedure intervention, which can be administered up to 6 hours minimum, and maximum in special cases some 24 hours also we can give this. But apart from this, after this, patient cannot be given this treatment. So this is why the acute management of stroke becomes very important. That is, as one notices the symptoms of stroke, he should be rushed to the emergency where a neurologist is available, so that he will be evaluating and deciding the treatment. Because early treatment, the outcomes and the improvement chances are very high. As the time delays in reaching the hospital and receiving the treatment, the chances of better outcome will be decreasing. That is, time is brain we call currently. And coming to lastly, how to prevent the strokes? Mainly the prevention depends upon the control of the risk factors. That is, as previously I told, one has to, if who is suffering from hypertension, diabetes, should be under control, and avoid smoking, and adapt healthy lifestyles to prevent stroke. Thank you. Please like, share, subscribe Health Focus All channel.